Good afternoon, everyone. I'm Mark Skidmore. I'm the director of the North Central Regional Center for Rural Development. Thank you for joining our today's webinar, which is funded by a grant from the USDA. It's a Rural Health and Safety Education Grant, and so this is co-sponsored with Purdue University and the NCR-CRD. Today we have a webinar focusing on the demand side factors influencing drug use in America, again focusing on the opioid crisis. That's been the focus of this webinar series. So we know that the drug epidemic has become one of the most devastating public health crises of the past century. And so this webinar is focusing on some of the demand side factors that have helped to spur the crisis. In November. Rosa, would you? So today's webinar is Michael Betz, and I will introduce him in just a moment. I just want to remind everyone that we also have another webinar later on in the year on December 7th. Sam Quinones, a journalist and author of Dreamland, will be talking about the supply side factors that have spurred the crisis as well. So keep those two on this one today, and then also the December 7th one on your calendar. Okay, thanks, Rosa. All right, so I'd like to introduce Michael Betz. Michael, thank you for being here. Michael is an assistant professor in the Department of Human Sciences and is a FCS state specialist at The Ohio State University. Michael Betz' research focuses on how local economic conditions impact a wide range of individual, family, and community well-being indicators. And right now he's focusing on the opioid crisis. Michael, this is not in his bio, but you may be interested to know that he was the goalie for the Ohio State University hockey team back in the day. So that's an interesting factoid for you as well. So with that, I will tell you that you can, if you have some questions or comments, you can use the chat section, and Michael may answer them along the way or wait till the end. And so with that, I'll introduce Michael. Michael, thanks a lot for being here.
Thanks a lot, Mark. And the first question I always get asked when people hear that is, are your teeth real? And given that we don't have any video today, you guys are just going to have to take my word for it that I do have all my teeth, and I'm smiling at you right now. So anyway, thank you, Mark, for inviting me to be a part of this webinar. This is really a fascinating topic that has so many factors that are influencing it. And it's impacting such a wide range of people that so many academics have started to do research on this, and that's partly why I wanted to get into this as well. As Mark said, my background is in regional economics and looking at why certain parts of the country are doing well and other parts aren't doing so well, and what are the factors causing those things, but also how those things then turn into real life factors that impact people's lives and their well-being and their health and so on and so forth. So this is kind of, the opioid crisis has kind of been the focus of my work over the last couple years, particularly because it's such a big problem in Ohio. And I titled the talk today, Demand Side Factors Influencing Endemic Drug Use in America. And I was giving a talk several months ago, and someone from the Ohio Department of Health came up to me afterwards because I used the word opioid epidemic, and they said that we're transitioning away of using that term epidemic because it's no longer an epidemic, it's endemic drug use. And so I'm trying to cooperate with them, and I think it is really telling. And it is a better descriptive of what's going on in the United States right now, is it's endemic drug use. So with that being said, the other part of my title there is the demand side factors that are influencing drug use in the United States. And so what do I mean by demand side factors? Well, as economists, we kind of have framed this problem and looked at um, the dramatic increase in overdose rates into causal factors, and we categorize those into supply side factors versus demand side factors. So supply side factors, those are things that affect the availability of powerful drugs. So we all know that the big story with the pharmaceutical companies and how they pushed to make prescription opioids regularly available to a much wider range of the general population, and the impact that's had. And on the other side of things, you have to say, okay, well, what is causing people to increase their demand for these deadly substances? So what are the demand side drivers? So the supply side drivers and are things like I said, with the prescription drug prescribing habits of doctors and how those have changed over the last 2 decades. And here's a graph of just showing um, the amount of prescriptions. Let's see if I can grab my pointer here. So this gray line here is prescription drug rates, and you also see overdose rates from all drugs, this dark red line up here, and then overdose deaths from prescription opioids here. And so you can see as prescription drug rates increased, drug overdose rates increased. This is a very familiar story, probably for a lot of you, and that was mainly driven by prescription opioids. Now, there were some things that affected supplies. In 2010, there was reformulation of OxyContin to make it abuse deterrent. So you could not as easily abuse OxyContin. And that was right here. And that kind of flatlined things for a year. Prescription rates kind of went down, and prescription overdose deaths kind of went down. And then you had these other things, PDMPs, prescription drug monitoring programs. And basically all of those are as an attempt to stem the flow of prescription drugs. And they were really effective. If you look at prescription rates after these 4 kind of key states implemented them, prescription rates went down. But what you see happened here is both opioid overdose deaths and overall drug deaths increased rather sharply. And so that's what we talk about when we're talking about supply side factors, things that are affecting the supply of dangerous drugs, primarily opioids in the system. And these are all OxyContin reformulation, the increase in prescription practices, prescribing practices, and prescription drug monitoring programs are all supply side issues. And that's not really the focus of my talk today, but I just wanted to kind of give you a contrast of what we're talking about when we're talking about supply versus demand side issues. Okay, so let's talk about demand side issues now. What are demand side drivers of this? Well, here's just kind of a broad range of things that could be affecting demand for these really potent substances. One, community economic disadvantage. Where you live determines how much opportunity you might have economically, and so that might be something that is playing into why people are using these drugs at a higher rate. Mental health problems, there's been an increase in depression and anxiety over the last several decades, at least those being diagnosed, and maybe that's just a diagnosis problem issue that's just showing up now. That's always been there, but there has been an increase in diagnoses of anxiety and depression. Relational problems, the United States is kind of founded on this idea of individualism and kind of an independent, autonomous spirit. But what that has kind of, one of the consequences of that is that we are also one of the most relationally isolated and relationally lonely. We've become one of the most lonely cultures in the history of the world. And then finally, health conditions. So things like sedentary lifestyles, we all typically work at desks now, and so some of those things could be causing an increase in chronic pain and that people are experiencing, and so people are medicating. So those are all kind of demand side factors, things that would increase people's demand for really potent substances. The one that I'm going to spend most of my time on, because it's my background, is the community economic disadvantage. And so that's what I'll spend most of my time talking about, with a nod to some of the other ones very briefly at the end. Okay, so let's start talking about what's been going on in the crisis and how local economic conditions might impact that. Now, here's overdose rates by education level, and this is in Ohio in 2016. Now, this really bright red line here is high school graduates. This dark red is some college. Let me get my pointer back out here. This dark gray is those with an associate's degree, and this lighter gray is overdose rates for those with a bachelor's degree. Now, we've all heard anecdotes of the high school football player who got injured and was prescribed some prescription opioids and got addicted, or kind of the suburban college-educated soccer mom who overdosed and died. But what this shows, and it's a little bit more exacerbated here in Ohio, but the same general trend follows for the rest of the United States, is that there's a wide disparity across education levels. And when you break down overdose rates, this is one of the demographic cuts that you can make, that really there's a large difference over different populations. In Ohio in particular, if you have a high school degree or less, that group's overdose rates are about 14 times higher than those with a bachelor's degree. So this real large disparity between someone with a bachelor's degree and someone with a high school degree or less. Even just having some college, there's a pretty dramatic decline in overdose rates for those populations. So it is concentrated amongst those with low population, or with low education. Okay, so when you're thinking about how economic conditions might be influencing the opioid crisis and the drug crisis, you think automatically, most people, the indicator that they think of is unemployment rate. And you look at unemployment rates and what they've been doing. The gray line here is Ohio, and the red line is the entire United States. And so you see, we've been kind of before the Great Recession, then you have the Great Recession here, spike in unemployment, and then it's been a pretty steady decline all the way through. And Ohio is probably pretty typical of most states. So whatever state you're coming from, your dark gray line here, your state unemployment rate would probably look something similar to that. And so you look at this and you think about that, and you think about, okay, what's been going on with overdose rates over this period? And let's see if I can draw at all. No, I don't know exactly how to draw. But basically, with overdose rates, what we've been seeing is this steady increase upward. We didn't see a sharp, dramatic reversal right around 2008 or 2010 during the Great Recession. And so you look at those graphs and you say, well, they don't actually match up. How can local economic conditions be driving overdose rates if those two things aren't kind of following the same pattern? And so what I want to point out is that unemployment rates mask a couple of things. The first things they mask is differences in geography. So if you look at this map here, these are just county unemployment rates in 2016, and you can see there's some high places with really low unemployment rates. So these dark gray areas are low unemployment, and the red areas are really high unemployment places. So these yellow circles here. So you have Appalachia and kind of places in the South with really high unemployment rates. And then you look at the change in overdose death rates between 1999 and 2016, and you look and you find some of those same patterns. Okay, so here in the Midwest, you see a lot of the unemployment rates were really low, and they also have low overdose rates as well. And then you look here in Appalachia, you see really high unemployment rates and really high overdose rates. Okay, but then you consider our other two areas where, we talked about here in the Northeast, they had really low unemployment rates, but they have high overdose rates. And then really down here in the South, where they had really high unemployment rates, but really low overdose rates. So what's going on? Even if you break it down, it's not geography that's kind of masking a trend, a connection between local unemployment rates and overdose rates. So one of the other big things that they mask is type of job. So when we're talking about unemployment rates, how we measure that as economists, there's a survey that goes out every month and they ask, do you have a job? And it's a yes or no question. And so they don't ask exactly what kind of job do you have. They ask that, and they use that for different statistics, but not for the unemployment rate. The unemployment rate just says you have a job or you don't have a job. And one of the things that has been changing over the last couple of decades is the types of jobs available particularly to kind of these middle skill workers in the United States. So here's a graph that shows you that ranks jobs by their skill percentile. So down here on this end of the graph, these are low skill jobs. And up here, we have kind of college educated high skill jobs. And then on this axis, it's the change in employment over the last 20 years, basically, last 25 years, okay? So anything above this zero line, this red line, is positive growth. That means those types of jobs have been growing. And anything below this red line is those types of jobs, those skilled jobs have been declining over the last 25 years. So what we see here is that there's growth, positive above the red line in the really low skill jobs, and growth in the really high skill jobs, and declines in kind of these middle skill jobs. So, these are kind of like your college educated jobs, and these are your jobs that might be like retail service jobs, things like that, working at a fast food restaurant. Very low skill jobs. And these middle skill jobs were kind of a little bit more complex, like manufacturing jobs where you had to have some kind of skill level. And what we see is that the labor market in the United States is kind of becoming increasingly bifurcated or divided, where you have a large concentration of low skill jobs and a large concentration of high skill jobs. And unemployment rates don't account for that, what type of job you have. And a big part of this story is what's happened with manufacturing over, particularly the decline in manufacturing has been happening for the last 40 years, but really pretty intensely over the last 20 years. So we see manufacturing kind of as this slow decline from the late 60s to right around the late 90s, and then right around 2000 we see manufacturing jobs just drop off a cliff here. And there's been a little bit of a recovery, but nothing in comparison to this sharp change in manufacturing jobs. And if you look at our four states that we looked at before, Kentucky, Ohio, PA, and West Virginia, with some of the highest overdose rates, you see that their manufacturing, and here this dark red line's Ohio, and this light gray line is Pennsylvania, had pretty sizable manufacturing sectors, and they saw pretty large declines in these middle skill jobs. Now, this dark line here is Kentucky, and West Virginia, they saw pretty modest declines, but nothing like these sharp declines in Ohio and Pennsylvania. So what's going on? Is it just these manufacturing jobs? Well, Kentucky and West Virginia didn't have very high manufacturing sectors to begin with, so they didn't have a lot to lose. But they did have very large mining sectors, and that's a sector that kind of is middle skilled as well, and has also seen large job losses over the last 20 years or so, and longer. So where are these jobs changing? Here's just an example of Ohio's jobs. These are the top three. These are the share of manufacturing jobs Ohio's total economy of total jobs in 2000 and 2015, and the same for government, retail trade, healthcare, and accommodation and food services. So you look in what this shows is that, yeah, manufacturing had this big decline. 5% of all total jobs decreased from 15% of total jobs down to 10% of total jobs. Smaller decreases in government and retail trade. So where are these manufacturing jobs growing? Well, they're going in growing sectors like healthcare and social assistance. So medical jobs, hospital jobs are growing, and that increased by 3%. So 3% of Ohio's total jobs. But you have to ask yourself, these people that lost their manufacturing jobs, they might be kind of middle-aged, 35 to 55 years old, high school education, or maybe even less. Are these the ones that are going to become a nurse anesthetist in 2015? Probably not. A lot of these people didn't end up getting retrained or going back to school to get into the healthcare industry. Where they ended up is the growth here in accommodation and food services. So these are just kind of like your fast food jobs or other kind of low-paying, low-skill jobs. Now here's a typical economist graph that looks super confusing and intimidating, but when you break it down, it's really not that difficult to understand. All this says is it plots out unemployment rates on this axis here, and then on this axis here, it has the job opening rates. So you're looking at any given unemployment rate in the United States. What was also the job opening rate? How many open jobs were there at any given unemployment rate? In these different colors, so this gray here, and then the red here, and then the blue here, are different time periods. And so we see the gray lines here are the expansion in the early 2000s. And then the red is the Great Recession. So you can see as the Great Recession has gone on, the unemployment rates went higher and higher. But then the blue line is the recovery from 2010 to 2016. And so you see during the recovery at any given unemployment rate. So let's say, just take 8% unemployment. How many job openings were there during the Great Recession? Well, there was about 2. Now, during the recovery, there was about 2.5 job openings. So at any given unemployment rate, we have more job openings now than we did in the early 2000s. So what that says is that even though there's job openings, that workers aren't able to fill those jobs. And part of that is a mismatch between the skills that workers have and the jobs that are available to them now. And that is consistent with the picture that I showed you earlier and the split between high skill and low skill jobs. Okay, so everything that I've showed you so far has just kind of been descriptive, but recently there's a working paper, a National Bureau of Economic Research working paper that connects these things with overdose rates. So you can say, okay, the descriptive story tells you, okay, that there's been a decline in job opportunities for these middle skill workers, and that may lead them to feel like they don't have any job opportunities, and that may lead them to despair and more likely to engage in illicit drug use or prescription drug use and abuse prescription drugs and overdose and die. But what this paper shows is they do some really nice statistical work, and they actually draw a causal connection between state manufacturing decline and increased overdose rates. So it's a really nice paper, and it's publicly available on the National Bureau of Economic Research, NBER's website. Okay, so what has been happening in the manufacturing sector that employment has gone down so steeply, but if you look at this is output for manufacturing. And it's kind of chugging along, and you see the steep decline during the Great Recession, but it's recovered again. And so output is just the same. So how is the manufacturing sector able to produce just as much as they did before the Great Recession as they did after the recession with so many fewer workers. Um, Let me skip along. And the answer to that question, and the answer to the mining question that's relevant to West Virginia and Kentucky, is that this is increasing automation. A lot of those jobs did go overseas to China, but a lot of them over the longer period have been replaced with automation, particularly in mining, where coal mining it's an immovable resource. You can't outsource coal mining, but you can use increasingly sophisticated equipment to get the coal out of the ground, and that's what happened in that sector. And so here's some work that came out early last year that showed that in local labor markets, if you had one more robot per 1,000 workers, it reduces the employment population ratio. So this is basically a easier way to measure an unemployment rate, something like an unemployment rate, or the number of people who are employed per population. So it reduces the number of people that are employed pretty substantially. And this is kind of contrary to the typical economic argument that as technological innovation increases and continues to march forward, everybody's going to reap the benefits of those gains in productivity. And what this paper kind of showed was that that's not always the case. When people have lost their jobs because there have been increases in automation, that they haven't immediately got hooked back up with new jobs. And so there might be something different going on that is different than the past 100 years of technological advancement, where people don't easily interchange between the jobs that they had and the new jobs being created. You think of the difference in sophistication between someone who was working at a manufacturing and auto parts manufacturing plant to the new jobs that are being created in Silicon Valley in computer programming. So there's a bigger gap there, and that might be part of the story. Okay, one concerning thing is that we currently have 47 million workers with a high school degree or less in things like driving jobs or grocery store attendants, fast food counter workers. These are all kind of medium skill, at least the driving is medium skill, but these are lower skilled jobs. And these are all sectors that stand to be automated within the next 5 to 10 years. A lot of you have seen some of the stuff about Uber and Google developing self-driving cars. Amazon opens a grocery store with no checkout. You just walk in, grab your food, and you walk right back out because it's all automated. So a lot of these jobs stand to be eliminated in the next 5 to 10 years. So what are we going to do with all these workers that are out of jobs? The second thing that unemployment rates mask is labor force participation. So here's the labor force participation rates in the US from 1948 to 2016. You can see here during the 60s, 70s, and 80s, as women entered the labor market, large increases, but right around 2000, there's been this large decline. Part of that is baby boomers are retiring, so there's not as many people in the labor force, more retired people, but a large part of that is unexplained. And there's an economist here, Alan Kruger, who did some research on that and looked at the people particularly men who are outside of the labor force, and he found that men who were NLF, not in the labor force, express much lower levels of meaning and satisfaction in their daily lives than men who are outside of the labor force. But this was not so for women. So women who are outside of the labor force, they find meaning, and possibly part of that is just kind of long-term historical cultural norms and roles that women have been able to stay at home and care for the children and care for their family and feel okay about that. But men, not so much. And another really fascinating thing that he found in his research and his survey is that half of prime-age men who were not in the labor force were using daily pain medication. That's just kind of an astounding fact. So there seems to be this connection there between men, prime-age men who are outside of the labor force, possibly because their jobs were automated or shipped overseas, and not finding anything that that can kind of replace the thing that they were doing and not finding much meaning in their daily lives. So this could be substantial. In 2016, 2.1 million people had an opioid use disorder, and this could account for up to 78% of non-baby boomer labor force participation drop. And it could be up to 100% in Kentucky, Ohio, and West Virginia, where you had high concentrations of workers in those kind of manufacturing and mining sectors that are now out of jobs. Okay, so what are some of the consequences of this job bifurcation, the splitting of jobs into high skill and low skill, and decreased labor force participation? Well, there's this story that economists like to tell, and I was kind of alluding to it a little bit earlier, that as productivity increases, everyone's better off. And we see that in the United States, that was true for a long time. Between 1945 and 1980, you look at these two, this thin blue line here is productivity, so productivity is increasing. And what's increasing right alongside it? Median real family income. So workers are more productive and their incomes are going up. Everybody's happy. But what we see is that since then, these trends have diverged. Productivity has continued to increase with automation. So you have your output per hour increasing, but it's kind of separated from median real family income, is flattened out. And so some people are really seeing these gains. College educated, those people that are really productive are seeing gains, but the median family is not. Another indicator of this is a graph from Raj Chetty's work, who has looked at income mobility over the last 50 years in the United States. And this is a graph of the percent of children earning more than their parents by year of birth. So here are the birth years down here, and here are the percent of children that are earning more than their parents. You look at 1945, really high. 92% of kids born in 1940 will end up making more than their parents. But you come down here to children that were born 35 years ago, and where they're at right now, it's 50% and probably fewer than 50% now, even later, in later birth cohorts that are making more than their parents. And so this kind of has a psychological effect because it's something that's pretty deeply ingrained in our culture, to this expectation that things are getting better and my kids will do better than me, and that's what I will provide for them. And from the children's perspective, I want to do better than my parents. Okay, so again, a lot of the stuff that I've showed you so far is just kind of a descriptive story, but there's been some causal research. Alex Hollingsworth in 2017, along with his co-authors, found that places that had higher unemployment rates also had higher overdose rates, and he controlled for lots of other factors. I alluded to the Kruger paper earlier that showed that men who are outside the labor force were using prescription drugs, and up to 50% of those who are outside of the labor force were using prescription drugs. Some of the work that I've done with my co-author Lauren Jones is we looked at employment growth in local areas at different skill levels, and we found that growth in low and middle paying jobs were protective factors against overdose rates. So places that had higher growth in those sectors that are employing low educated workers disproportionately, places that had growth in those sectors had lower overdose rates. And then the Kofi, Hurst, and Schwartz paper that showed that manufacturing is a key part. State manufacturing levels, places where they declined, you had higher overdose rates. Now, at the same time, you have other papers that have showed that even though local economic decline is connected to overdose rates, it's a small proportion. So Chris Room here in his 2018 paper, he kind of pits these two supply side versus demand side arguments against each other, and he says that, demand side factors, they do play a small part, but it's only a small part. The vast majority of the increase in overdose rates is from the supply side, the increase in supply in dangerous drugs, and the same with Janet Curry's work in 2018. So to skip this. Okay, so our conclusions, they're pretty nuanced. On one hand, we do see that local economic factors are playing a role, but they might be fairly small. And one of the things that's interesting to look at against the supply side issue is just a solely supply side issue and kind of overselling just a supply side is when you look at all leading causes of death of those under 55. This is the US and PA. These are ranked. Drug overdoses are number 1, but suicide and chronic liver disease are number 2. So these things that have climbed up the charts, these causes of death, suicide and chronic liver disease, this chronic liver disease is from people who are in essence drinking themselves to death. Those don't have anything to do with the supply of opioids in the system, and they've been increasing pretty rapidly. I shouldn't say they don't have anything to do, but they're not as strongly connected, and so we wouldn't imagine to see such large increases with that because of a prescription drug crisis. Another thing that's really interesting that I kind of want to point out here is when you look at substance abuse disorders and the trends over the last 10 to 15 years. What you see here, these are all substance use disorders. And you look at the rate of the total population with a substance use disorder, and that has actually declined over this period, remarkably. And when you look at that, the decline has been almost entirely from those with an AUD, which is an alcohol use disorder. So substance use disorders have actually declined over this period, and it's been driven almost entirely by a decline in alcohol use disorder. So 2.6 million fewer people have an alcohol use disorder. You say, okay, well, what's going on there? That suggests that maybe there's the demand side doesn't play as much of a role because you have fewer people that are going to substances. Well, when you look here, you see these are different substances. And so, you have marijuana use disorder, green line is cocaine use disorder, blue line is prescription pain relievers, and then this kind of yellow triangle line is heroin use disorders. Now, that saw a small bump up in 2009, around 2010, and so you see this small increase. It doesn't look like much, but when you calculate out the numbers, it's about 230,000 more people have a heroin use disorder. And you think about, okay, what's been the increase in the number of people who have died? It's about 72,000 in 2017. And I think what has gone on is there's been this shift. These people that had the alcohol use disorder, a small portion of them shifted to heroin. And you don't need many people shifting from alcohol to heroin to have a huge spike in overdose deaths like we've seen over the past 2 decades. Now, interestingly, if you look at this here, this is the marijuana use disorder. You don't see an increase in marijuana use disorders, but what you do see is a huge increase in marijuana use. So you have 10 million additional users using marijuana. Now, what that might suggest is that marijuana isn't quite as addictive or people don't have a disorder at the rate that they do with alcohol. So people have been substituting away from alcohol into marijuana, but it's not showing up in disorder rates. And there could be a lot of factors. Doctors haven't been trained to screen for that or ask about that as much yet because it's becoming legal and things like that. So there's some issues with recording and measurement. But it's interesting to note that you saw this huge decline in those with an alcohol use disorder and also a huge increase in the number of people using marijuana as it's become more legal. But you didn't see an increase in the number of people that have a marijuana use disorder. Okay, so takeaways, U.S. drug crisis is more than a supply problem. Local economic conditions do influence overdose rates. and the coming automation is likely going to exacerbate that. Automation is only uh, growing more rapidly, and it's affecting more sectors, and so we should be thoughtful about how we approach that, and how we think about that, and we make policies regarding that, because it is going to affect um, people's overall well-being and their health. Okay, so thank you very much. Any
Thank you,
questions,
Michael.
if we
Yeah,
have
we do
time?
have a little time. We have a long question here from Allison.
Okay, yeah. Childhood trauma, poverty, and educational difficulties are all correlated. Children who grow up in poverty and or experience multiple adverse events tend to struggle in school from an early age and are on a disadvantaged developmental trajectory that continues in their adult lives. Totally agree. Part of the solution is to invest more in early childhood. Two, not everyone wants to go to college or is able to be successful in college, and college is really expensive. Sometimes I hear and see people discussing college as the golden ticket out of poverty, but it simply isn't a realistic option in many cases. Very true. Yeah, so I'll talk about these things one at a time. I totally agree with the early childhood argument, and if we go back to some of my policy thoughts, is these investments in education and health, particularly in pre-K. So investments down the line, when workers are older and trying to retrain them when they're 35 and 40 years old, they're much less successful than getting kids into early literacy programs and early pre-kindergarten programs. Those have proven to be incredibly cost effective, where $1 in gives you about $2 to $3 out. So I'm a huge proponent of pre-K, and totally agree with you on that one. Two, not everyone wants to go to college. I totally agree with that. And usually when I have more time, I tell the story, an anecdote about my brother-in-law who is a driver at UPS, and he went to community college for a year and a half, and he has a learning disability, and he wasn't able to graduate. And no matter how hard he tried or how hard he worked, it wasn't going to be in the cards for him. But he's a good, hardworking guy, someone that you think of kind of like your typical American middle class, works hard for his family, and through his job at UPS, he was able to buy a house and support his family, and it's a really good job. But that job is probably going to be disappearing in the next 5 to 10 years because of automation. We need to think about what we're going to do with regards to that. So yes, I totally agree that college is not for everyone, and we need to think about and be very thoughtful with regards to what are we going to do if the large part of the population is unemployed because uh, robots have taken their jobs. And okay, and then you have a third point here. Cultural norms and gender socialization absolutely impact men's social networks and their ability to find meaning outside of work. This is why dismantling long-held cultural assumptions and myths about gender is important, not only for women's empowerment, for the well-being of all people. What would be the impact of raising the minimum wage? Okay. Yeah, I agree with the gender norms things. It seems like women have become comfortable going into the labor market, so they can find meaning inside and outside of the home, but the reverse hasn't been true for men. So more support for men, being kind of the primary caregivers in their homes, and having a role inside their homes, and shared responsibility at home. Definitely supportive of that. So
Okay, well, while we're finishing up here, we have an evaluation that we really appreciate your feedback on, so please take a moment to do that. Michael, I was going to ask you about the percent change in some of these drug use rates, alcohol use, or I think they were maybe death rates. If these were in percentage change terms, so if the U.S. population is growing by, say, I don't know what it is off the top of my head, I guess about maybe 1% per year. So if you didn't want growth as a proportion of population, would the rate and those rates be about 1%? Is that how to read that?
Are you talking about the kind of the
Yeah, the
last
last
graphs?
graphs. Because they were in percentage terms.
Okay.
So if it's not increasing, but it's at 5%, well, that's a lot more people who are engaging in this
That's right.
activity relative to population growth. But if it's at 1%, then we're not seeing any significant changes, right, relative to population size. Okay.
That's right. That's right.
Well, I really appreciate you coming on. It looks like we do have one more question, and maybe this will be the last one that we can take for today. And of course, if you have additional questions, you can contact Michael directly.
Yeah, and the question is, what do you know about the effectiveness of treatment for opioid abuse? From my understanding, the success rates are extremely low. Does this mean we need to think about proper oversight and regulation pertaining to these expensive treatment options? Yeah, I think that's something that we need to consider when we're coming up with solutions, policy solutions, is that currently almost all of our policy solutions and all of the money that has been devoted to addressing the drug crisis has been for treatment and recovery, and that's great. That definitely needs to be there, but as Barbara points out, that success rates are incredibly low. So the people that I've talked to is the professional medical professionals who actually administer treatment. They would say, over the long term, that there's an 80 to 90% relapse rate. Um, and heroin addicts that I've talked to have told me that once you use heroin, you're a heroin addict for life, and it's something you're going to struggle with your whole life. And so, how successful can these programs be? I don't know. I think that's something that we should be doing all that we can to help people who want to get help, but probably the bigger bang for our buck is going to be the prevention dollar. So investing in education and health and pre-K, um, support for families, support for working families, expansion of the earned income tax credit, things like that. Um, but the hard thing with those is that they're really not politically sexy policy options because they take a long time to have an impact. If you're investing a pre-K dollar right now in kids, hopefully with an eye of preventing them from becoming an addict 15, 20, 30 years down the road, that's a long-term investment, and politicians typically like to do what's going to have a quick fix so they can kind of show the success that they've had. So there's a political challenge there as well.
Yes, it's a challenge. Um, well, I think now is maybe a good time to close off the webinar for this afternoon. Thanks to everyone for joining. Michael, thank you for all the great information. Really appreciate it. Have a
Thanks,
You
Mark.
bet.
Thanks for having
Have a
me.
good afternoon.
Great. You too.